want to talk to you guys about today is really just, what does rehab mean, and what can we do for your patients, and just kind of educate you a little bit on the different therapies that we use, and talk about some exercises and that sort of stuff. And I have presents because we're going to have a few questions, because I know you're all suffering from a lack of Halloween candy now, because it's been 1 week from Halloween. So we'll see if we can get you a treat here. So what are our goals of rehab therapy? Basically, we're looking to restore, maintain, promote optimal function, fitness, wellness, quality of life as they relate to movement disorders and overall general health. How many in the room have been to see a physical therapist? Right, just about everybody, right? You can all relate to the fact that when you've had injuries or you've got something that's bothering you, that a physical therapist can often really help you get through that. And we've recognized that our veterinary patients are no different than that. You'll notice through this talk I'm using the term rehabilitation therapy. So by trademark or some legal thing, we cannot describe what we do in animals as physical therapy. The human physical therapists are very offended by the fact that we would like to use that terminology. So we talk about animal rehabilitation therapy or veterinary rehabilitation therapy. So what do we do in rehabilitation therapy? We're looking to promote healing following injury. We're looking to enable return of strength and mobility, minimize scar tissue formation and contracture due to muscle scarring, pain relief, injury prevention, and weight control. And just to spend just a brief sort of few minutes talking about rules and regulations, who can administer rehab therapy? This is the proverbial can of worms right now, because all through North America, there's lots of discussion at the veterinary regulatory boards and with the human physical therapy regulatory boards about who can do this sort of stuff. As it is right now, you could go to every state in North America and there will be a different set of rules that pertain to that state. Here in Canada, there's also some differences between the provinces, but a general rule of thumb is that you should be having direction from a veterinarian who is basically able to diagnose what that animal's problems are and then assign a therapeutic plan, and then you guys as the technicians can then carry out that plan. But you should be under a veterinarian's supervision, and so I'm sure you're all aware there are a few areas in our location where there are people that are offering what they class as rehabilitation therapy, and they're not veterinarians. A lot of them are not technicians, and some of them haven't even had any specialized training. So you guys as sort of the forerunners in your practice who are talking to these clients, and people are looking for what else can I do with Molly, who's 14 years old and geriatric and having a hard time moving, where can you send me? Make sure that you're going to send those pets and those clients to someone who's had the training, so that we're making sure that what we're delivering is the quality of product that we want veterinary medicine to be recognized for. So what I want to do is just go through sort of what techniques are available for rehab, and that kind of breaks down into a few different categories. We'll talk about manual therapies, the treatment modalities that we use, therapeutic exercises, and hydrotherapy. So manual therapies, as the name would suggest, this is what we do with our hands. And this is going to be basically simple things that you can do with your patients in terms of massage. And we talk about 3 types of massage. Effleurage, which is coming from the French word effleur, which means to glide or flow. And this is a very gentle kind of stroking maneuver that you're going to do. If you've ever gone to a massage therapist, they always start by just kind of gently running their hands down your body, right? What that does, it kind of heightens your body to the fact that, know, you've got this touch, and touch is a very powerful part of rehabilitation therapy. So we can do effleurage on our patients, and this works really well in a post-operative patient where you've got a little bit of swelling, and it's just basically using the back of your hand just to kind of gently stroke the tissue, and that's going to get things moving, the lymphatics moving, the blood and tissue exchange of fluids, and that's a real easy thing to do. Petrissage is more of a firmer type of massage.
How soon do you start that?
You can start that, you know, basically the next day. Okay, so petrissage is, comes from the French word pétrir, which is more of a mashing or a kneading. And this is a much firmer, sort of thicker type of hands-on, and you can do it in a broadening stroke. You can do it kind of by grabbing the tissue and sort of pulling it up. You can do it as a lengthening maneuver. But that's going to basically be much more of a deeper kind of tissue maneuver to kind of, again, get the blood going and, you know, lengthen and stretch those muscles. And then friction is the last thing that we do, and friction is basically aimed at breaking down scar tissue. So you're going to be doing this primarily over tendons and ligaments. So over joints, for example, and primarily what we're going to do is cross-friction massage. So, you know, imagine the elbow joint, and you're going to just take your fingers and you're just going to do sort of a rubbing. I mean, basically, you're just looking to kind of break down some of those adhesions that might develop post-operatively or after an injury. And then we talk about passive range of motion and active range of motion. The difference is passive means just that. Your patient is not really a part of that range of motion. So they're comfortably lying and you're doing all the work. And passive range of motion has a role, probably more right after surgery, just to kind of get things moving a little bit. But in terms of actually getting a muscle to work, you're doing all the work, not the patient. So we don't expect a lot of benefit from passive range of motion. And from a therapist standpoint, mostly we're using passive range of motion to assess range of motion in the joint, and we use a little protractor kind of device called a goniometer that will measure what our flexion and extension angles are in a joint. We have sort of set standards for normal, and so we'll measure those after injury or when we're looking at post-operative patients, and we use that now as a goal to say, okay, well, if we're starting at X and we need to get to Y, how are we going to get there? And that's what we want to know what our starting point is. Active range of motion means the patient is actively involved. So this is movement that's occurring, and you're going to use movement to help build muscle. So just a mere activity of walking would be considered an active range of motion and is a type of manual therapy and rehabilitation. And then joint compression is another thing we use, just again as part of pain relief and fluid movements. You know, if you ever have this on yourself, it's a good thing to try. You know, I'm a surgeon, my hands are tired at the end of the day, and if I just come and I just compress my joints, it feels amazing at the end of it. And again, you know, if you've been through any kind of a Swedish massage, you know how they always kind of squeeze your fingers and they're right out to the very tips? That's compression, and compression is a really, again, it's a tissue stimulation. It works really well in our veterinary patients. So these pictures here are just basically at the top here, we're just doing a little bit of petrissage. This is a post-op cruciate dog, and there's a little bit of swelling kind of down at the ankle. Just by gravity, the fluids kind of get down in that area. So we're just going to use our thumbs and kind of just with broad strokes, we're going to push that tissue out. And then down here, we're showing more of a compression type maneuver. So we're going to support the joint above and below, and we're just going to compress that joint to get a little bit of pain relief and a little bit of fluid transfer occurring. So now let's kind of switch gears and we'll talk about treatment modalities and what we use. And some of these are really simple and you don't need to spend a lot of money in your practice to do them. You know, some of the more expensive machines you can spend several $1,000s on, but there's a lot you can do with very little financial output. So we're going to talk about cryotherapy and heat therapy, laser therapy, neuromuscular electrical stimulation, electromagnetic therapy, and ultrasound. So cryotherapy is really simple to do. Never underestimate the power of ice. And you know, in medicine, it seems that we waffle back and forth between do you apply cold to something or do you apply heat to something. The current thought right now is that cold is better in that first 72 hours. So you can put this on anything where you feel that there's inflammation. So this is any kind of traumatic injury, and surgical intervention is trauma. So any kind of post-op incision you can apply cold therapy to. Anytime you've had a tissue injury or anything that you perceive as an area of heat or inflammation, ice is very good. And how are we going to apply that? You're going to do a 5, 5, and 5, or a 10, 10, and 10. So that means 5 minutes on, or 5 to 10 minutes on, 5 to 10 minutes off, and then 5 to 10 minutes on again. And what the cold is going to do is it's going to basically get into the deeper tissues. So if you apply a cold for 5 to 10 minutes, you're going to have a tissue effect of about 1 centimeter depth. And you have to think about this when you're doing sort of big things. So post-op cruciates, if you put 5 minutes of ice on that incision, you're going to get the incision area, but you're really not getting into the deeper parts of the joint. In order to get to the deeper tissues, you're going to have to go for a much longer period of time. Now, there is a phenomenon where if you apply a cold therapy for longer than about 15 to 20 minutes and the temperature of the tissue drops 5 to 10 degrees below normal, you will actually have a reverse phenomenon, and you'll have a vasodilation, which will actually cause more inflammation. So you need to be thinking a little bit about the fact that really when we're doing cold, we're looking for vasoconstriction and pain relief, and we're probably just going to be more treating superficial type things. Why does it work? It decreases blood flow to an area through vasoconstriction. It makes the nerves cold, so the nerves don't stimulate the tissues as well, so there's decreased pain, and there's going to be decreased inflammation associated with that. And just a picture here showing use of a cryotherapy pack on a patient. I'm just going to say one more thing about the cold therapy. If you're going to use that, you have to make sure that you have your cold directly in contact with your surface of interest. So if you have big air pockets in between, say, your bag of frozen peas and the skin, it's not going to work very well. So you want to have that cold right directly adjacent to the tissue. So that's why gel packs work much better than bags of frozen vegetables. And you can use ice exactly just like an ice cube, and you can paint the tissue with that. But we use a lot of the commercial gel packs in our practice because we can kind of mold those right around the leg, put a towel on that, kind of secure it in place, and then kind of do some other things with the patient at the same time. Heat therapy, heat is going to be used primarily after 72 hours, and what we're looking for a heat modality is we're looking actually to increase circulation. So we're looking for vasodilation effects now. Pain relief, we might do heat as a way to kind of warm the tissues up prior to doing some exercises or stretching. So that's going to bring in more blood flow into that area. It's going to make the tissues a little bit more relaxed. Anytime you have chronic swelling, you might use heat because we're trying to, again, bring in this added blood flow in that area. Muscle spasms and heat can also be a help in tissue healing because, again, it's gonna bring more blood flow and lymphocytes potentially in that area that are going to be very helpful. We don't want to use heat anytime there's circulatory compromise. So if you have an area of tissue that's been damaged severely, so thinking about sort of post-radiation treatment or any kind of burn or an area where the skin is really fragile, definitely don't want to bring heat into that area because it's not going to be able to feel the heat as well, especially areas also that have no pain perception or decreased pain perception. And if you've been in practice long enough, you've pretty much always seen the case where we've used some kind of warming device against the skin when the animal's been anesthetized. They haven't been able to get away from that device and they've ended up with some kind of burn area in their skin. So you can do this just by putting something on an area that doesn't have good sensation.